what we try to do is help people to understand that we can help them get a doctor. We can help them get connected. And we try to explain to them that fortunately, our system, at the Institute, we have family medicine doctors that can treat the whole family, right? They can treat the mom, they can help her through pregnancy, they can do their yearly GYN checkups, they can treat the child, the infant, the grandmother, the father, right? One doctor takes care of the whole family. And it's very similar to the countries that they come from.
Welcome to the Bronx Health REACH Community Coalition podcast. I'm Felix Rojas, who will be hosting the podcast. I'm a community health worker with Bronx Health REACH, a 80-plus member community coalition launched in 1999 to eliminate racial and ethnic health disparities in the Bronx. For the past 9 years, myself, along with my co-host today, Cheku Umar Ann, has been doing outreach for the Immigrant Health Initiative led by the Institute for Family Health and Bronx Health REACH. The Immigrant Health is a program that focuses on decreasing health disparities among foreign-born New Yorkers, regardless of the immigrant status. Funding for this program is provided by the New York City Council. We focus on 3 goals: promoting access to health care, dismantling cultural and language barriers to needed health care, and increasing access to resources and interventions. We partner with New York lawyers for the public interest that provides pro bono legal consultation and public health solutions that helps people obtain free or low-cost health insurance. For this podcast, we'll be talking with Guedy Arniella, Director of Community Health and Outreach at the Institute for Family Health, and Kristina Davila, Project Coordinator at the Institute for Family Health, that are involved with the Immigrant Health Initiative. Good morning, ladies, and welcome. Tell us about the Institute for Family Health and your roles.
Hi, Felix. Thank you. I'm Guedy Arniella. I'm the Director of Community Health and Outreach at the Institute for Family Health. We provide healthcare at 27 different sites. We have freestanding health centers. We also provide healthcare at school-based health centers for children to be able to get their care right at their school setting. And we also do a lot of work with the homeless population at numerous different sites throughout the city. And we're really happy to be able to work with immigrants. So we're glad to be here to talk to you about that.
Hi, it's great to be here, Felix. Thank you for that amazing introduction. So yes, as you mentioned, I'm Kristina Davila. I'm the project coordinator for Immigrant Health, and I've been working on this initiative for 2 years, I believe. And it's been great. I love connecting people to care. I love meeting people and, really assessing what they need and helping them as best as we can. So yeah, it's been a great initiative and I really enjoy the work that we're doing.
Thank you. Thank you for the invite and thank you for participating in this podcast.
It's our pleasure.
Okay. Thank you, Guedy. Thank you, Kristina. I'm going to ask you a specific question is, what is your role in the Immigrant Health Initiative and how long have you been involved in it?
So I've been involved with the Immigrant Health Initiative for the last 6 years. We're going into our 7th year now. And Kristina, maybe you can say a little bit about your role and how you've been involved.
Yeah, absolutely. I believe I mentioned earlier I've been at IFH for 2 years. This is my 3rd year, so I'm fairly new, but I have definitely enjoyed this work. We work a lot with immigrants to connect them to care. We focus on the barriers to care. So we know that there's a lot of different factors that affect people getting to their appointments, whether it's transportation, language barriers. And my role really helps to connect with people and to create sort of a liaison between our clinics and the community. So I'm definitely a community person. I love being out and talking to people and really just being there to listen and find out what their needs are. and trying to help them as best as we can. I think that is our mission at IFH and also as part of the Immigrant Health Initiative. I'm always glad to help anybody that needs it.
Yeah, one of the things, Felix, that
Mhm.
Christina does, and sometimes I join her, is we
Mhm.
go out to community settings where there are a lot of immigrants. So, for example,
Mhm.
we've been going out to the shelters and
Mhm.
talking to immigrants there, and oftentimes they don't understand our medical system, and so we help folks understand that it's important to have their doctor so that they don't have to go to an emergency
Mhm.
room if they
Mhm.
need
Mhm.
care. We also tell them about our free clinic, where they don't have to pay for anything at all. And Christina makes an appointment for them, either
Yes,
right
indeed.
then and there, or
Mhm.
she calls them back, and
Mhm. Mhm.
and we use WhatsApp, so it makes it easy for immigrants
Mhm.
to help make the appointments for them.
How does this initiative help immigrants seeking healthcare?
Well, like I said, immigrants don't understand our medical system here in the United States, right? So the first thing we do is try to help them feel safe with us. People are very frightened. Oftentimes, they've just come to this country and they don't know about how they can get health care other than going to an emergency room, which we all know is not really helpful, right? Unless you have a heart attack or a stroke or a broken limb, the emergency room is not the place to go. You'll spend hours and hours there, and then they tell you to go see your doctor the next day, right? So if you don't have a doctor, then what are you going to do? So what we try to do is help people to understand that we can help them get a doctor. We can help them get connected. And we try to explain to them that fortunately, our system, at the Institute, we have family medicine doctors that can treat the whole family, right? They can treat the mom, they can help her through pregnancy, they can do their yearly uh, GYN checkups. They can
Mhm.
treat the child, the infant, the grandmother, the father, right? One doctor takes care of the whole family. And it's very similar to the countries that they come from. Whereas other health centers, you have to go to your primary care for adults, you have to go to a pediatrician for the children, you have to go to the GYN for the women's health issues, right? So our system really takes away a lot of the barriers that families face when they first come to this country. So, that's a win-win situation that makes it easier for new immigrants in this country to get the health care for the whole family. I don't know if that actually answered your question, Felix,
Most
but
definitely, most definitely. I mean, and then it's a great service that we provide.
Yeah.
yeah.
Christina, do you have to add up something, or I think Eddie went around it.
Yeah, I think Giddy, you like hit the ball out of the park. But I would say yes, that family medicine is really what sets us apart. That there are other, federally qualified health centers, but the fact that they can come to us and we can try to schedule them together because especially everything is new to them. It's a new system. The transportation is completely different. The language. So even trying to take the subway, it's something so normal and typical for us. For them, it's really difficult trying to figure out what is uptown, what is downtown, right? So
Exactly.
sometimes if
Mhm.
they go together and they take their kids, sometimes their kids can say, Mom, it's this way, and try to figure out directions together. It's really important for them to have that support.
Great, great. But but which communities do you focus your outreach? Because I know us like me, sometimes they get me going to the Muslim community and the West Africans, first going to the Latino, but we know we cover everybody. But do you have some particular groups of immigrants you be focused on?
Well, we don't. I think Cheku, like maybe what you're referring to is like that because you speak so many languages, you focus on the Muslim community, I think, or the African community. And Christina and I mostly speak Spanish. I think Felix also. We tend to focus more in Manhattan and Brooklyn and Queens. And I think the two of you focus more in the Bronx, which is part of Bronx Health REACH. But we are happy to come to the Bronx. We have done that many times, and we could come and help out there and with any population. We do a lot of work with Grameen, which is a group that's on, which street are they on, Chris? Like
I think it's
145th Street?
yeah, 141st or 149th, yeah.
In the
Right.
Bronx, right? But otherwise, we're mostly like in Manhattan, Brooklyn, and Queens. We haven't done anything really in Staten Island, but if there's a need, we go. We try to go anywhere that people, ask for us to reach out to immigrant communities and do whatever we can to help. There's just two of us, right? So,
Yeah. We're actually it's four of us because the way that we connect, from this side, I connect most with Hispanic, with the Latino communities,
yeah.
and then we go to churches. We got to all denominations, and we give it an invite, and then we talk to them in the same language. That's what connect to us, and that'll be
Exactly.
easy for them. They'll be like, like they're gonna be like less stressful when we talk to them. It's the same. It happens with the Muslim community because I learned so much from Sheikh Umar that I'm like, we have a good team. We connecting with our people one way or another.
Yeah, and we help each
Mhm,
other, right? Like Cheku
mhm,
has come out.
Definitely.
We've been doing some work at a men's shelter in the Bronx, and the large majority of the men are African. And Cheku was amazing in coming and helping to connect with them. It really does make a difference. We were using our phones to do the translation, but there's nothing like being able just to connect with someone in their language and be able to help them feel like, oh, we understand and we can help.
indeed, indeed.
Yeah, and
What?
just to let you know, sorry, Felix, just to let
It's
you know
okay.
that, you see, I thought that outreach had stopped when I went there, but they pass out my numbers to almost everybody in there. They're calling me for all those issues, especially over what's going on now, about
Yeah.
trying to switch over the hospitals or the appointment or all that stuff, because they have this, the situation going on is just as a threat for them. So things are switching over. Now they don't want to give me, that's like you see when we're sending the referrals, they're sending us their email instead of giving me their phone numbers. So most of them want to give their email so they can track it instead of having their phone number. So our outreach ways is changing a little bit, but for the best, And we like when Christina just do it next day, like the day after, it's no
Yes,
waste of
indeed.
time. Things have changed. But I would go to the next one asking what the strategies that you use successfully to connect with immigrants. I know you're doing good, you and Guedy and Davila, how do you use to reach out to them? Even with language barrier, it happened that you had names and numbers to connect with. So how do you do that?
I can say that I think it's so important to be patient and to be present and just to listen more than you speak sometimes.
That's a
Yes.
fact. That's a fact.
That's
Yeah.
your style. I see that.
Yeah, because you'll learn a lot from what people tell you.
Hmm.
So then you can build on that. You can say, "Oh, you mentioned you need help with this. Do you have anybody that's helping you? Do you have a doctor?" So I feel like it's not always the best approach to be like, "Oh, we have all these services and we have all these locations." Like maybe sometimes hear from them what they're looking for first, and then you can kind of figure out how you can help them.
Yeah, I
And I have,
agree with Christina.
yeah,
I'm sorry, Felix.
100%. No, 100% no. And
Yeah.
I'm learning that for Christina. I have to listen more and jump
Yes.
on the gun less. Go ahead,
So
Gary.
I could share an example. Like I was talking to this immigrant family. They had traveled 6 months through a forest, and there was no
Wow.
clean drinking water. It was a mom and dad and a couple of children. And like the mom was telling me that the little girl was hospitalized for one day because she had parasites from
wow.
drinking the water from the river. They didn't have any choice, right? They had to drink that water. And so, from hearing her story, I realized that the child was hospitalized, but the parents didn't get any treatment, or the other child, for the parasites, right? So parasites are easily transferred from children to parents. The whole family needed to be treated. And so we connected them to our doctors, and they all got the treatment just because the mother was telling me, oh, yeah, she was spent one night in the hospital because she had parasites, and she, her stomach was upset, and, she had diarrhea. So, but just listening to that and talking to one of our doctors about it, we connected the whole family because they all needed to be treated. Otherwise, it would keep happening over and over.
Yes.
So just listening and
Mm-hmm.
then sharing with our doctors, and them telling me, oh, Getty, they really need to, the whole family needs to come in so we could treat them. Otherwise
Okay.
it's not going to get better.
Yeah, yeah. There's a question here that I even asked myself on my partner Chiku is, what attracted you to this initiative, Christina and Gary?
Yeah, I can say that for me, it was definitely a big career change. So I'm actually a musician. So I came to this initiative through Getty, and it was an interesting transition, I will
Yes,
say.
indeed.
A very, very
Wow.
big transition. And I think there was a lot of uncertainty on my end if I was going to like this job, if I was going to enjoy it. But as soon as I saw how we were helping the community, um, and the empathy that you need, I knew that it was a good fit for me, and I've enjoyed it. IFH is a great place to be. We all help each other out. I definitely enjoy working with you, Felix and Cheku.
Well, thank you.
Yeah, I appreciate
That's
that
the
we
first one.
collaborate. Yeah, no. I appreciate you guys, and I appreciate how we collaborate together. It's really meaningful.
Well, for me, we just got this opportunity because Bronx Health REACH had gotten uh, some funding from the New York lawyers for uh, the public initiative, or it's NILPI, right? So, and then after that, we got our own grant, and that led to, the Department of Health reaching out to us, asking us to partner with them. We were going into the shelters and helping them to get the children vaccinated so they could go to school, right? So we would go when they were giving the kids their first series of vaccination, and then we give them an appointment to come for the second series. So, just like the collaboration between a lot of different agencies, government agencies, even different organizations that work with immigrants, it just seemed like we were doing so much to be able to help the community, and to be able to use our language, the ability to speak different languages and to connect with immigrants in the community that really needed to be able to help the children, right? To like get the kids to be able to go to school. They couldn't go to school without the vaccination record. So all of that, just the possibility of being involved and helping people's lives to be better, helping children to be able to, integrate into our school system, and to learn and to grow. I mean, it just is a win-win situation.
Okay, Getty, just the organization is known as the New York Lawyers for the Public Interest.
Oh, thank you, Chiku. Yeah, I couldn't remember the last couple of letters.
Neither do I.
I call them so much that I know it by heart now.
Okay,
NYPLI.
you're their best customer.
In the time that you have been doing this, what effect or impact have you seen on the immigrant communities that you serve? Example, I'm going to by us a little bit, example, what happened to the immigrant? What the community deserve? What impact did you have around them?
I think it's difficult to measure, but just the stories, and
Mhm.
like, the story I shared about the family that traveled 6 months through the forest.
Mhm.
Uh, there was a woman that we helped. She was pregnant, and she was, I think, 6 or 7 months pregnant. She had not received any prenatal care at all. We were able to connect her, and
Mhm.
she got, checked out. She got prenatal care for the last few months of her pregnancy, and we were able to help her deliver her baby safely.
Awesome.
These are just two stories. There are so many,
Many. Yeah.
you know, uh, we've helped hundreds
Mhm.
of people in the last few years that we've existed. And so, we just want to let people know that they could just reach out to us and we could help them in so many ways. Christina and I can connect them to healthcare. Jaco, you have connected people to the New York lawyers for public interest, now that I got that right.
Yes.
Right. So like I mean, we can't do everything. We have to
Mhm.
tell people we can't do everything, but we have resources that we can connect them to. And that goes a really long way.
Mhm. Yeah. What about you, Christina?
Yeah.
Don't I know you be singing to these people. That's why they give you the information so quick.
Yeah, I agree with Getty that it's really in the stories that you hear from people.
Mhm.
Um, Off the top of my head, I encountered this little girl that she told me, I love going to school. It's my favorite place to go. I love math. I
Mm.
love science. She was so smart, so bright. And she said, but I really, really urgently need my vaccines because I'm not allowed to go to school anymore and I'm so sad and I just really want to go.
Well,
And I said, well, I have a solution for you. I can
there
Yes.
you
help you
go.
with that. So yeah, I helped her schedule an appointment and she went and she was so grateful. She was so incredibly grateful that she was going to go back to school. So that's just,
Oh,
again, one of many stories that we encounter all the time.
yeah. That's a
Exactly.
great story to listen, hear from a kid that wants to go, like, love to go to school.
I
That is
know,
something.
right?
Yeah, right? So this is a question that I ask myself a lot, and my partner, Chick One Umar, because we keep checking on each other every other time, many, many times. And is what has been the most rewarding part of the Immigrant Health Initiative? What is most rewarding to you guys? Chris?
Yeah, I would say getting to help people. That's, for me, that's the main goal. Whether it's one person, if you go somewhere and there's not many people, if you make an impact on one person, that's all that matters. And, we're there to hopefully make a difference in their lives. And, as we know, health is a priority. Unfortunately, not everyone can do that as a priority because they have so many things going on in their lives, which is understandable. But if we can help if we can help them close the gap and make it a little bit easier, that means the world.
That's
Yeah,
great. And,
Christina.
and actually, yeah, and actually, that's like going the extra mile. Because myself, I encountered that I have to take the people that I call with my car to the clinics to make them feel safe for whatever environment we're right now. And that's the most rewarding part for me when they call me back and they say thank you. Can I send my cousin or brother or somebody that somebody that knows somebody? So of course. And then we give them our number, we give them our emails, and they can call us like anytime. And then you put them at ease. And then, like I said again, it's like taking myself them to the clinic in order for them to feel safe. That's rewarding as well.
Yeah, for
Getty?
real.
Yeah, I think that being able to be yourself and sharing your humanity, and then being able to take away the barriers, right?
Mhm.
Whether it's language, whether it's not knowing where to go, whether it's like just them being able to say, I need help, after such difficult times that that they had to experience to get here. So, I think all of it is rewarding, all of it,
Oh,
this one little girl, like, we kept going back to the same shelter, and after a while, like, she would come running up to me and hug
Wow.
me and thank me, and she wanted me to come up to their room, and she wanted to give me like tea, and it just like being connected to human beings, and knowing that your presence there is appreciated, even if you can't do a lot, you know,
right.
just
Yes.
just connecting with them is it's an unbelievable feeling.
Exactly. I'm telling you. I just went to something last week. I think last week it was in Walton, and I see a couple of Muslim ladies, her husband, they came in there. And I was so surprised how they came in there. And I didn't want to ask them a lot of questions, but on their way out, I just went out to ask them, "Oh, how did you get it?" She said, "Yes, we got this appointment to two ladies. I know it was you two." I said, "Oh, what make you come there?" She said, "Because the first they went because they see somebody else besides somebody from them. If it's an African recommending them, they say that the concern that the people have on their health, that's what make them go. So when they go, they realize really they had all those issues that they didn't even know. So they were sending their family coming back and forth. They say now they don't even coming to us and just calling us. They're sending them to just go there now. So they're making
Yeah.
an appointment, they're going there. So I was so proud and happy of when they told me that. I was so happy. I said, oh, at least I seen somebody that we gave an appointment and then went there and sending their family there. That was a nice reward we had from there.
That's great
I,
to hear, Cheku. And the reality is that when it comes to health, we don't know, right?
Yes,
We're like
yeah.
exactly.
encapsulated in these bodies, and we don't know what's going on around or inside.
Hmm.
That's why it's important to go for your yearly checkups,
For
right?
real.
And to have somebody that you feel safe and comfortable with, right? So
Exactly.
I'm glad to hear that too. I'm glad to hear
Yeah,
that
yeah, yeah.
families share with each other, and
Right.
they're like now understanding
Hmm.
that, to be checked out is like really important.
Yes.
And you know what is myself? It connect me in a way, to wire me in a way that this job has made me more human, like you're like more grounded, like like Felix, bring down to the pedestal that you always been, and this bring me back to planet Earth, and it makes me a better person, a better human, to connect with immigrants that these services needed. Guedy, Christina, and check one. What is the best way to connect to us and with us?
Yeah, absolutely. So I'm happy to share my phone number and email so you can reach me. My phone number is 646-832-7144. And my email is kdavila, like my first initial and last name, at institute.org.
I can be reached at 929-215-9506. And my email is cann@institute.org.
And you can reach me again. My name is Felix Rojas. My number is 917-650-0987. My email is Rojas Felix with an X at the end, 42@gmail.com.
Well, you can reach me at 917-751-2161, or GARNIELLA at Institute, INSTITUTE.org. One last thing I want to mention is if folks would like to visit our website, www.institute.org. You will find a lot more information about our Immigrant Health Initiative and other programs that we offer.
Thank you, Gary. Thank you, Christina. Thank you, Check One. I know we have a hectic schedule, but I'm blessed enough to have you in this podcast. And the invitation is open again. Hopefully, we'll be together talking about all the service that we provide for the institute and for the people. And my name is Felix Rojas. I'm a community health worker for the Institute for Family Health. I wish you all a blessed day, and thanks for your time and patience.
You've been listening to the Bronx Health REACH podcast. You can email Bronx Health REACH at bxhealthreach@gmail.com. You could find Bronx Health REACH on social media. For Facebook, Bronx Health REACH. For X and Instagram, BX Health REACH. And on Blue Sky, bxhealthreach.bsky.social. The views, thoughts, and opinions expressed and presented by our guests here on the Bronx Health REACH podcast are their own and do not necessarily represent the views, thoughts, and opinions of Bronx Health REACH and the Institute for Family Health.